Hi, I'm Dr. Alan Kossman.
And I am Adrian, Dr. Alan Kossman's assistant.
And we're here today to talk about Implant Wide. I guess if we look back 4 years ago, we were Implant Wide customers or clinicians before there was even an Implant Wide. 4 years ago, I was invited by Dr. Chapko to come observe an implant surgery at his office, and I said, yeah, I'll go check it out. We'll go observe. I have no interest in doing implants or any surgery of any type whatsoever. It just wasn't my thing. Didn't feel like it seemed busy enough. Thought it would be best left to the specialist. And I observed, and I thought it was interesting. And I decided to come back a second time at his invitation. He's always been, how can I say, always opened up his doors, opened up his office to come observe and to show some of the things he was doing and learning so that we could therefore learn and eventually do. Then he encouraged me to bring a patient by and said I could do the implant. And he'd watch me and help me hold my hand. And we did that. And it went great. She still has her tooth. And it was an immediate. And then he suggested I bring another patient by. And then he suggested I buy a kit, a Nobel kit initially, eventually OCL kit. And he suggested we go to a seminar together. Then he suggested we work up a few cases. This is all pre-implant wide days. And he said we work up the case. This is also pre-cone beam days. He suggested that I schedule some patients after we work the case together, that he would come to my office and stand over my shoulder in the hallway, just in case there were any challenges and complications, which there weren't. That's kind of our start with Implant Wide. It's progressed to where, well, I'm talking too much. What was your reaction when I first told you that I was considering doing implants?
You were crazy. I still think he's crazy, but no. Basically, without the help of Dr. Chapko, our practice would not be at all what it is today. Without his help with the oral surgery, even down to suturing, the physics forceps, for instance, what to buy, what to purchase, who to get it from, this is better, this is not so good, I've tried this, bone grafting material, everything down to the implants themselves. We definitely, as clinicians, would not be the same without him and owe him much thanks for all of that. He's a wonderful teacher. He's very passionate about everything he does and everything he has to say, and he's goes above and beyond as far as being helpful. Reading the CT scan machines, I would not be able to read what I can and do what I can without his help. So thank you, Jim, and I'm really glad to see that he's turned it into a business and is very successful with it, and that everybody else can learn the way that we did and become as successful at it as we have.
I also want to say I looked at today's schedule. Today we have 6 patients in today. We have no implants scheduled for today, but we have 6 patients scheduled for various reasons. Other restorative treatment, in for recare, in for crown impressions, implant crown impressions, or placing implant crowns in the abutment. But out of 6, just to pick a day at random, I picked today, 6 patients, and of these 6 patients who've had implants done, are 6 different people. Together they've had 10 implants total, meaning some have had 2 or 3. And I just look at that, and Adrian didn't believe me. I said, count up, and she agreed. So that, to me, that's just amazing. Again, I think that Jim does a lot of the homework for us, a lot of the research. I feel sometimes guilty that I don't study as he does, or devote as much time, or take as much training. I do what I can, what I'm comfortable with. He's always taken it to the next level with his education and with his his scope of practice. I'm still a onesie-twosie guy. I do a lot of single implants and a lot of 1 or 2 side by side. That's my comfort zone, and we're plenty busy with that. I feel as though we've benefited. I think there's three key aspects. First, it's been one of personal growth. In other words, it's always fun to learn new things and try new things. The things we learned Implant Wide, we're able to apply almost immediately. So personally, it's been challenging, exciting to learn. Professionally, it's helped our business in many regards, whether you're looking at your production, whether you're looking at this, expanding your scope of services, whether you're looking at getting referrals, people now coming in or have come in because for implant procedures, it's brought new patients in and thus their families for whatever treatment they may need.
We don't have to.
And the third thing, and the most important thing, like I said, is personal growth, professional growth. And it's, by the way, it's been a tough economy for a lot of offices. I feel like we've held our own, and we've actually seen an increase over the last couple of years. And this year, in the last 3 or 4 months, phenomenal growth, mainly due to implants. So personal growth, professional growth, and the most important thing of all, patients. Patients have benefited from the things, from either having procedures done at Implant Wide or from things that we've learned at Implant Wide that we can apply directly in our own office. I feel like patients have received less invasive procedures. They've received different options. They've received cost-effective treatment. And people always appreciate that they've been able to, not that Implant Wide and the service we provide are some kind of discount warehouse dental thing, like it's quality materials, it's quality implants. It's just done at a slightly lesser cost to the patients, and that benefits everybody.
We don't have to break bad news anymore and say, oh, so this tooth has to go, and by the way, to replace it, it's going to be X amount of dollars, and blow them away. It's realistic, it's affordable, and they're doing it, and that's the most important thing, is they're not walking out the door feeling discouraged that they're going to be missing something because they just simply can't afford it. It's now affordable and realistic, so. Thank you, Jim.
Let's see, anything else to add?
No, really, there's no risk in doing it. You can do nothing but benefit from going, for sure.
I like the approach of the learning process because Jim's approach to me as a friend and as a colleague, years ago when I thought about buying an AccuCam, he says, just buy it. I'm like, well, it's so many $1,000, just do it. I'm like, I'm thinking about getting a dental software computer. There's so many out there, just get Dentec. When it came to implant things, he's like, just order this and order this and order this. Jim orders a lot of stuff. Jim does have the implant superstore. Jim.
He's the Costco of implants.
Jim is the one who I guess I'm thankful that he's buying different kits and trying different systems, and he's doing a lot of the things that I find hard with being busy here, busy with my family and young kids. Cost-wise, I can't buy 10 implant systems. I can't buy just implants to just have on display to look at, to choose from.
Right.
He's
tried it all. His trial and error benefits the rest of us, for sure.
I'm not going to try 20 different types of bone graft materials and buy 5 of each of them so I can try out 20 different ones. I'm going to buy a few that I've learned about and that seem to work. So Jim does our homework for us. He does our research. It's especially fun. I guess one of my fondest couple Implant Wide memories to date is when I was doing the procedure and Dr. Jim was my assistant, and we had never really realized our height discrepancy, so he had to get a step stool. That was fun. I enjoyed the time when we had worked up a case together, and he told me what he was going to do, showed me how he was going to do it, and that day there was maybe 7 or 8 people observing, and he said, "Do you want to do it?" And at first my heart sank, because it was kind of a low sinus, kind of tricky positioning. I realized it was my patient, and why not? So I kind of felt like I was a rock star on center stage. I felt like I was Jim. Jim is truly a rock star of dentistry.
He's a rock star of dentistry, for sure, the Gene Simmons of dentistry. And I always enjoy my quizzes while being there, for sure. To date, I haven't gotten anything wrong. I don't know what I'm going to do if I ever do get a question wrong, Jim. I'm really sorry if I do. But yeah, he's always challenging both of us.
The other thing that's of interest is that everyone's welcome. If I say, can I bring 1 assistant, 2 assistants, 3 assistants, he, of course, bring everybody. He Implant Wide helps promote implant services to patients. It is or should be a team approach, and so Implant Wide facilitates that very well by letting us go in. And patients also are very receptive. They like the fact, I have 2 cases there to share. I sat down with the patients and just looked them in the eye and said, I know you want implants. I have a few concerns. It's challenging. It's maybe beyond my scope. I'd like you to, review it with one of my colleagues. And one's response was, "Oh, you mean Dr. Chapko down the street? I've heard of him doing the implants, and I that's great. I asked permission to the patient, can I send a disc that we've taken and have him do a little workup?" And he said, "By all means, I want teeth, and sooner the better." And when I explained how it would be a team approach, I would be there. I would be learning, doing some of the procedures under his guidance. Thanks again, Dr. Rockstar.
Dr. Rockstar. Dr. Simmons.
Dr. Olaf.